Well, welcome everyone. I'm Donald Weeks, the founder and CEO of ClearPath AI and the host of the Clinic Efficiency Podcast. And today I have a very interesting guest, Mr. Shiv Kumar. He's a co-founder and CEO of Solvist. Shiv, your background in computer science and engineering combines with your leadership at Solvist and Swasti truly stands out in the mission to build AI-powered solutions to complex problems, especially making healthcare more accessible and efficient. It's clear you're not just building technology, but building solutions that have deep social impact. Welcome aboard.
Hey, thank you, Don. Thanks for
Welcome,
having
Shai.
me.
Yeah. If you could you give us a little bit of your background and how you got started and what you're doing today?
Sure. I was born and raised in this blessed country, India, and I started my career as a techie. Decided that coding and doing project management is the thing to do. That was a time in the 90s, which was the in thing to do. But I really quickly found out that, while it's interesting, I want real life issues that I want to work on. And that's why I stumbled into a social enterprise, management degree, and which really piqued my interest in terms of working with complex issues, complex problems of the society and working directly with people. So here I am. I use the technology to do complex problem solving at a system level.
Excellent. Well, Shiv, your work with Solvis and Swasti emphasizes moving AI beyond theoretical applications to practical, impactful solutions in healthcare. When did that vision for human-centered AI in clinical settings really start to take a hold for you? And what was the initial spark that led you to focus on operationalizing AI for frontline workers?
As you know, Don, AI is not new. I think AI has got center stage recently because of the significant developments we have seen in the last 1 to 2 years. I think 15 years back, we worked with Microsoft Labs, looking at our data where sex workers who were to come for STA treatment, we would follow up with 13,000 of them on a weekly basis. And then we used AI to find out who is likely not to come to the clinic. And that dropped down to 5% of the population. And therefore, we could be very targeted with 98% accuracy. Nothing new. It's survival analysis, which credit card companies use. But then along with the power of AI, we were able to really focus our field team's attention on people who need that, right? So that's a classic case of what we have done. But one thing I realized while doing that, it sounds very easy and sexy the way I'm describing it. But what is very, very critical is to build those use cases, test it out, see whether there's a real life impact. Firstly, ensure there is no negative impact, right? So I think that's what led us to believe that there are some great companies, great tools out there. They're all solutions looking for a problem, but we are on the people side looking for solutions. So we need to do that bridging and communitizing, as we call it.
Right. Yeah, that sounds good. Yeah, especially on the people side and making much more accessible and I guess more patient centered focus by the attendants. That's good. Let's see. You highlighted a significant challenge in AI implementation, which is bridging the gap between its potential and its ethical, practical application in diverse healthcare settings, particularly when dealing with data silos and integrating with legacy systems. Can you share a specific project where Solvus successfully navigated those complexities to achieve a tangible efficiency gain in the clinic?
Well, absolutely. I'll take a recent example. During COVID times, which is not very recent, but I'll begin my story there, where we actually used, sewage water testing to predict where the next COVID outbreak is going to happen, right? Not a significant technology. It's been around for a long time, used in Europe and US and other countries. But we gave around 7 to 10 days advance notice for the government in terms of outbreaks. Now that led us to, once COVID was out, we were thinking, what do we do with our platform? Should we close it down? And they said, hang on a minute, climate change is real. And what are the effects of climate change in terms of various outbreaks? And can we leverage it? And that's where we worked with the Indian government and got access to 30 years of climate data and 15 days advance, and then working with individual state and provincial governments and looking at their integrated disease surveillance platforms. When we married these two data, it took some time. Once we married these data, we were able to start to predict events, right? Whether there's going to be a malarial outbreak in this area. Why? Because there's rain, and then there is a certain amount of humidity, which is going to lead to a certain amount of larvae coming in. And therefore, can we predict the malarial outbreak? And can we predict whether, we have enough drugs, enough testing kits, right? Then we started getting even more, should I say, greedy. We said, can we do this at individual level? Because some of the state governments had individual people's records, right? Which are must, obviously, for, privacy. But we were able to say these 13 women who are pregnant right now are going to have a bad outcome because we have every parameter which is showing that this person is highly likely to have a bad outcome. And we were able to serve it to the frontline workers. So these are two case studies where I think data has led to actually saving lives, but there have been many intermediary steps.
Yeah, well, that's very good. Yeah, I haven't thought about it that way, but yeah, you can tie in the climate change, what's happening in the environment with, like you said, the malaria outbreak because you got a lot of the monsoon rains and things. So that's very good. Yeah, that's a very innovative way of using it. Swasti's focus on public health in India, especially in maternal and child health and communicable diseases, presents a unique scalability challenge. How do you approach designing AI solutions that not only deliver measurable ROI beyond pilot projects, but also effectively reach the large, diverse, often underserved populations?
Yeah, most people describe Indian health system as confused, you know, too many people doing too many things. It's not very organized. To me, it's like Indian traffic. If you understand it, it's extremely well organized. It may not be kind to the last person walking on the road. It may not be kind to the two-wheelers, but it still keeps it flowing, right? So if we appreciate that diversity, there's a lot Indian health systems can deliver. And so therefore, where do you begin? I mean, to me, most of the health systems lack an operating system, if I were to put it in a very techie language. Now, when I say operating system, I don't mean health information systems or some other technology which is running a facility or a transaction, but there's nothing actually which is patient centric, which actually delivers value to the patient as an operating system and delivers value to the provider as to make them high quality in terms of what they deliver. I think that's where we found a huge gap, and we decided that look, can we work on quality of care from four enablements, right? Physical enablement, which is of course good quality clinics, counseling centers. Digital enablement with, what can the provider be able to do even before the patient walks in, right? How can we enable the patient, and how can we enable the entire system to work as a whole? I think that's where AI can play a massive role, right? We don't need to write software as an apps. We should be writing AI agents which can actually do the talking and walking. We don't need to
That's right.
look at standard treatment guidelines in a book which is this thick, but it should be very, very adaptive to the questions that is being posed by the provider or by the citizen.
Right. Absolutely. Well, given the sensitive nature of patient data and critical health decisions, ensuring ethical AI and trust is paramount. What specific frameworks or approaches does Solvist employ to build AI solutions that are fair, transparent, and maintain human oversight, especially when augmenting with the decision making of healthcare professionals?
Well, Don, this is an area even the biggest companies like Meta and others are failing, right? And therefore, what is required is very good guardrails and policies. And I'm very happy to share that India has recently released the AI policy in health called Sahi. So, luckily in India, we now have a framework which we did not have before. So that is a guiding kind of a document for us. There's also the guideline given by WHO on ethical use of AI. And I think more importantly, when these solutions are built, having a third party who understands technology but is looking at it from an ethical point of view is absolutely critical to have on the table, not as consultants or people who can give you a certificate, but as people who can continuously monitor is the ethical framework being used at every level of our delivery, right? So to me, from design to implementation, the guardrails will have to be both internal and external. Fundamentally, Don, if the approach is going to be about monetizing data, I think that's where the problem springs from, right? I think if the idea is not to monetize data, but it's about delivering value, I think the business model changes from being extractive to being inclusive.
Right. I think with that new legislation there in India, I think it also kind of like what we have here in the States, where doctors are using the AI technology to help them, speed up maybe some of the diagnoses or to, provide some supporting evidence. But the doctor he doesn't give up that authority. The doctor still is the one that makes the decision.
Mhm.
And I think that's paramount. A lot of people, are worried about that, but I think it's paramount. The doctor uses it as supporting tools, not as the actual diagnosis.
True. There
So
are two sides to that, Don. One is not to
yeah,
overrule the intelligence of a qualified medical professional, whether it's a doctor or a nurse. The other side is also to
Right.
not make them lazy, that they are completely dependent. You and me have been there. If you're not careful about a document which you've looked at in ChatGPT or any of those, you can have wrong things coming in, right? So I think it's going to be challenging, but at the same time, hugely promising. So I think this next 3 years is going to be so critical. And then when I was describing all the guardrails, they're not fully in place. Lots need to be done to really
Right.
have this
I
working at the
agree.
ground.
Yeah, I agree completely. Well, looking ahead, you've expressed a strong desire to democratize AI in healthcare. What types of signals or metrics are you really honed in on right now to drive the clarity across Solvist and Swasti? I mean, ensuring you're building towards responsible AI ecosystems that foster continuous improvement and adaptability for underserved populations.
First and foremost, as I mentioned to you, we would like the public health experts to define the problem statements, not take a solution and see how does it work for us. So we need to begin with the global burden of disease. We need to look at where is the maximum. I mean, if India has got 60% of women anemic, I would like to solve it, and I would like to see how AI can solve it to the extent that it can play a role, right? So the first important thing for us is to really look at what problem are we solving, right? The second is to say, how are we democratizing the choice of solutions so that there is no one AI solution we prefer over the other? And Don, as you know, things are moving so fast. You know, everybody is trying to catch up with everybody. So we don't want to be tied down to one technology, but we need to be having a framework with which we work with technologies, right? So that's the second part of it. And the third is the guardrails that I mentioned to you without being scared of the technology, but to know technology can do harm as well as do good. And having that non-romantic, practical view to technology, I think is absolutely essential. And that brings incentives, behaviors, guardrails, ethical frameworks, ability to pull a plug and call out things in time are all the third thing that we look out for. So these three things, if they're combined well from the design to implementation, then the chance of those successfully landing in a health outcome is reasonably high.
Right. Yeah, it's good. Well, considering the rapid evolution of AI, what's been most surprising about the journey of implementing these advanced solutions in real world clinical environments?
I think what's been incredibly exciting and surprising is number one, how prevalent human errors are, right? Particularly for repetitive
Right.
things. For example, if you take lung TB and you look at an AI driven diagnosis versus a doctor driven diagnosis, the difference is significant. And one wouldn't have assumed that. And this is a fairly simple thing to diagnose. But I think repeated observances, I think AI is far better, is very well proven. So I'm just surprised how the alpha or the beta in that is there. The second is how quickly the voice
Right.
related, scribe and other things which are coming in, which are really capturing conversations like you and me are having. Imagine this between a provider and a citizen. And the beauty of it is that
Right.
earlier it could only recognize one voice, it would only type one thing. Now it's able to absorb accents, it's able to take multiple people talking, it's able to shut out the background noise, and it's able to provide clinical notes. I think that's extraordinary
Right.
from a quality of
Yeah.
perspective. And the third thing which
Right.
really excites
Absolutely.
me is wellness technologies, not just medtech. The whole range of them, right from handle diagnosis to smartwatches like this, insidables, wearables, epigenetics, you name it. I mean, there are like 56 different areas where AI is going to just explosively power them, right? And that's where I'm
I
really
agree. I agree. Yeah, I agree completely. I've talked with several other companies that are in that market, and they're doing a lot of that wellness, in between visits, where they continue to monitor and help the patient follow the regimen that the doctor has prescribed for them, what they need to do. A lot of times they'll tell the doctor, yes, we understand, and shake their head and say, yes, sir, we know. But when they go home, they forget. They don't know exactly how to do, what he told them. So they're doing a lot of that as well, which I think is very helpful.
absolutely,
Yeah.
absolutely.
It's very good. Shiv, is there anything else for our audience that you would like to say that maybe I haven't brought up or ask you about?
A couple of things. I think finding investors for these areas is really tough, right? You need investors who take a long-term view, who believe that we don't have all the solutions, but who's also open-eyed and curious on how applications can occur. And, they also focused around the health outcomes, not necessarily quality is only an enabler, but, are you focused on the eventual outcome and are willing to experiment and take risks? I think I'm finding investors like that quite difficult to find. So that's something which may be very clear to your audience, but I'm just probably stating it on behalf of them. I think that's one area. I think also the whole, you know, what we typically call as people centered design or design thinking I think needs a complete rethink in the age of AI. It's no more sitting for 3 days with people and coming up with a design thinking, right? But you can even transform the problem statement completely. The thing which I started liking is Socrates Circle as a methodology, where you actually interrogate the problem for 3 days but don't find solutions. Then you get deeper from different points of view and combine. Sorry, and when you combine them with AI, then you probably are looking at getting really deep in terms of solutions.
Right. Yeah, it's very good. Well, thank you so much for sharing your insights, Shai. I think this was incredibly valuable, and I really appreciate your time and your openness today. Thank you so much.
Now, Don, thank you. Thanks for what you do. It's very important for the community of practitioners and people like you and me who are consumers of those services. I think we'll have to help the providers do the best, but also the patients.
Thank you. Okay, we'll stop the official recording there. And how did that feel on your end?
Perfect.
It's
I
good.
love the way you roll.
Okay.
So
Yeah, thank you.
I like natural
Yeah.
conversations. Sorry, I was having a little bit of itch in my throat.
Oh, yeah, I understand. No worries there. I know my wife is fighting allergies right now.
Oh.
It's pretty bad. Yeah.
Was
So
it okay
I
for
just
you?
wanted to ask you real. Oh, yeah, I think so. And we'll see, with the some of the quality with the video as it uploads and records, we'll see how that all works out. And I'll go through and I'll edit it and give it the very best audio and video that we can see. So, but yeah, it'll take me just a few days. I'll put everything together and I'll send you a link for all the files so that you can download for your own content and use as well. And then I'll send it out to LinkedIn. I use Instagram, Facebook, and YouTube, and I'll put it out there after you've viewed everything and said it looks good. Okay.
Sure.
But
Absolutely.
yeah, I do appreciate that. And I was just wondering, is there anything in like with your business that you're working on now? Is there any real challenges that you're running into, or anything that maybe a company like ours could maybe help out?
I think if you can help me with what are the three things that you folks are good at, then I can find the fit. There are too many problems for me. That's what I'm
Sure.
saying.
Okay. I know. I know. Well, we're ClearPath AI. We mainly work with medical and dental and med spa type practices. And also, I started out with nephrology and dialysis clinics as well. But what we do primarily is we find how we can eliminate the chaos in the practices or the clinics by designing intelligent, automated systems that relieve some of the administrative workload, increases better workflows, things like that. And it actually frees up the people at those clinics to be able to, take care of more patients, patient care face to face rather than dealing with all of these administrative burdens. So that's pretty much what we do in the clinics. And we also, on the other side, especially with dental and med spas, a lot of them, they're looking to grow their business. So they need help, with their marketing and things like that. So we do that as well.
Right.
But yeah,
Now, what
yeah,
I can do is one, we can onboard ClearPath AI as one of the solutions that we can, offer to the governments here and to the private sector.
right, right.
That's very eminently doable for us. The second
Yeah,
is if I can have a full demo of the product, then we'll be more knowledgeable on where to suggest it as a solution. Right.
right.
Those are two things definitely I can do. And third, I can also do is that if you have ambitions in India, then I can connect you with events. There's one happening on 10th of April, which is on AI and healthcare. I'll just share the link with you. Uh, you know,
Okay.
I can keep you posted on those. And if you have any representative here, or we can attend and say, you know what, Don, you should probably talk to these guys. Right. So those are three things that
Yeah,
I can see.
absolutely. Right, right. Yeah, it's so funny. We're so closely connected with India, here in the States. So there's so much business going on back and forth, which I think is very, very helpful. But yeah, we personally haven't done anything with India yet, but I know that's coming. It's something because of the way we work. It's going to happen here soon. But yeah, that's
India is
very good. I appreciate that.
India is going to be the biggest application market for AI. I mean, I'm one of the
Yes.
most open societies to receiving it. Of course, China will be way ahead of it. Absolutely scarily
Right.
ahead of everybody else. But
Right.
yeah,
Absolutely. Yeah, and if you, know of any other companies that, I'd love to talk to that, you could maybe introduce me to learn more about what they're doing and, use that with our podcast as well. I think that would be fantastic.
absolutely. We'll do that. We'll do that,
Yeah.
Don. Thank you.
Okay.
And I will not
Well,
switch
thank
off
you.
my laptop till it finishes the uploading. And I
Okay.
will, thank you very much. And once it is done, do share it with me.
Sure.
I can, share it with my comms team
Yes.
for any comments. And then once you upload, we will promote it too.
That sounds great. Thank you so much, and I really appreciate the talk today. Thank you.
So thank you for the opportunity.
Okay. Bye-bye.